Hello, my name is Dr. Sachin, and I'm a consultant psychiatrist at Vallanad Hospital, Vattapalam in Kerala. So today we are going to speak about dementia. As we know, right, dementia, it is like one of the most common presentations in an OPD of a neurologist or a psychiatrist these days. And you can call it as a because of a boon of the healthcare facilities we are receiving right now because of the enhanced healthcare. The life expectancy has been increased. So as a result, no, we can see more number of cases of dementia, more number of cases with the behavioral symptoms of dementia these days. So as per WHO, I think around 55 million cases are there, which with 10 million cases, new cases each year. And one of the most common causes of disability and dependency in an old age is a result of dementia. And as we know, right, we have all heard about the Alzheimer's type of dementia, seen commonly in many movies and all. Apart from Alzheimer's, there are many other causes like which you may not be know like as a result of the recurrent vascular events like the vascular dementia, Parkinson's dementia, and all and all. So the most important part for a caregiver or what we need to understand are the symptoms of dementia or what is dementia. The most common mistake that we all make is just consider dementia as only forgetfulness. No, dementia is just not only forgetfulness. Of course, the memory disturbance part, the forgetting daily activities, forgetting like where the things are kept, forgetting to learn, like difficulty to learn new things, that all are there. But apart from that, dementia can also have other things, other symptoms. That is failure to recognize the familiar objects, failure to do, difficulty in naming these familiar objects. I can know what the thing is, what this thing is to write and all, but I don't know how to name try like correctly, like tell out what is this. That is the pen. Oh, I can know what this thing around me and my wrist is there. I don't know correctly. I don't know how to name it. I can know like there are my son is this much, but I don't know his name. So that is all correct. Difficulty in finding names of objects of persons and difficulty in recognizing familiar objects, which I like used to know earlier. That all causes are there, and there is also difficulty in doing complex tasks. I like even though I did know cooking on every aspects of cooking previously, I do not know how to make even tea now. I do not know how to plan each step of tea, and I do not know how to make like each like all the process of tea. Which step should come first, and which should come step should. I don't know even to button my shirt. So that all sometimes comes under apraxia component and the executive function deficit. We know how to plan and act now currently, but in old age, this executive function deficit can also be a part of dementia. Along with that, we know people tend to lose their way around home, lose their way around like familiar neighborhood, even which were very familiar of. That is a visual spatial orientation deficit and all. So as we see, dementia is not just memory disturbance alone, and some of these components should also be there to criteria to be called as dementia. And this is the most important concept. This is the most important thing which we used to educate the caregivers about regarding dementia. So then what we can do is like after understanding dementia, what we must do is, there is a saying like there is no option to change the course of dementia, but we can change the like journey through dementia, right? There is no other option to change the final outcome, final what we know what they are getting into. But that journey, it can be altered through proper support like proper care and all. So for a caregiver to find after understanding dementia it is not like not forgetfulness. These all things can happen, and like these some behavioral symptoms can occur. So what are the things which we can like or a caregiver should take in account to in treating a person with dementia? And remember, the caregiver burden is so much that it is so overwhelming to take care of the person with dementia. And even though you know that the person is only going to progress, deteriorate further, and even then to being to take care of a person requires monumental effort, especially in this new busy world where everyone is running with their lives. But simple steps, simple things which we need to take care, which we need to educate, can do man a difference in a person with dementia. Like many simple things, like keeping a daily routine for a person with dementia, extremely important. We might see like one of many of the things are so simple that but we have to understand that the person with dementia is can only lead a very simple life. They can't afford the complexities, like doing a basic routine, like waking up at this time, brushing, taking breakfast at this time, regular breakfast, regular lunch, and regular activities at this much point of time with very good activity scheduling can do help them a lot, rather than having a breakfast at 11 or someday. Sometimes this comes at this length. Sometimes people come like they are going out at this time. Some servant is coming at this time, and like it will be back to the complexities of their life. Keep it simple, keep it scheduled, keep it regular. That is one of the most important things, like dressing, eating at the same time of the day, and help them with other removing other distractions in their life and all. So then we can also empower the person to write down their list, write down their appointments, write down the events in a notebook or a calendar which they are like which is in around their room, so that they can keep on remembering or keep on keeping in their notice about the events which they should not forget. Even if their difficulty in writing is there, they can, with the new technologies, they can help in record the voices and hear it again and again. And the caregivers can also reorient them frequently, like they used to forget the new learned tasks they used to forget. So we can reorient them, like this is time of the day, this is the year, this is the month, and you are currently having this, you forget this because you are having this sort of a problem now. But that is very important also. That is very very, it takes a lot of caregivers, because you tell them right now and this person will forget whatever is been told in next moment. So we have to again keep on repeating them, keep on reorienting them. So that is one more thing. And apart from writing them, in helping them write a notebook and all. And well, yeah, just like others, we have to plan their activities, plan the activities which the person enjoys the most. Suppose if a person enjoys gardening, suppose the patient enjoys making a stroll out in the garden, like promote those activities, plan them at each time of the day. Around 4 p.m. you will have a stroll in the garden. Will take you out of for the stroll at the same time. Plan to help them to garden, help them to take care of their car, or if the person helps in like having a drive out, help them to especially engage in activities which they enjoy. And newer technologies help them to keep a reminder for those things. There are electronic devices available around us. This Alexas, this mobile phones, everything will help them to keep a reminder. Oh, this is the time to brush the teeth. This is the time to take a nap. This is the time to take like a bath. This is the time to do breakfast, and all the things which we can do. And another thing is to take the apraxia part, that allow the person to do as much as possible by himself only. All the efforts, like dressing, bathing, help them to do that mostly by himself under supervision. And remember that as we have said, the complexities are to be avoided, right? So we'll allow the person to wear only easy to wear dresses, dress like a simple like upper or simple trousers, simple the dhotis, or simple everything, rather than complex shoelaces, complex coats and jackets and all. So loose fitting, comfortable clothing which the person himself should help in wearing. Or nowadays when the electronic toothbrushes are available, which the person empower the person press him, take care of him alone, take the care of oral activity alone, rather than taking the help of a caregiver. And always the most important thing, be gentle, be respectful. We have to frequently tell the person what he's going through, step by step, through every activity. All these are simple steps which the caregiver can take care of to further decrease the overwhelming nature of taking care of a person with dementia, and to reduce the caregiver burden also. Because once these symptoms are taken care of, the person will also be having taking care will be a relaxing experience. And remember, sometimes these sort of symptoms can aggravate so much that they will need a consultation with a psychiatrist or a neurologist to take care of some aspects, like reduced sleep disturbances, the behavioral symptoms, this violent behavior, aggression. Persons can have delusions, false fixed beliefs, aggressions, that all need to be taken care of. And do not hesitate to seek treatment. You are not alone. The doctors can also help you with medications and all. So that is something which we need to also, even though it is not something related to a particular disease, so it can be a state of life, but we can take care of treatment with the help of a doctors and all. Do not hesitate. That is also upon the caregiver, because the person with dementia cannot take care of himself, cannot take himself to a doctor. And the regular medications, regular meals, regular dressing, regular activities, planned activities, all the things are a vital role in helping the person with dementia. So again, that is much more the most important thing. Thank you so much for patient listening. See you. Thank you.